Look at the camera.
Yeah.
And go.
Welcome to Staffordshire Area Health Branch's first Facebook Live event. We're today talking about how to use the Just Culture Guide. So we've got our guests here. Do you want to introduce yourself?
Yes, my name's Jane Beach. I'm the lead professional officer for regulation, and I also work here in the West Midlands.
Hi, my name's Frank Keogh. I'm the lead regional officer for health in the West Midlands and also look after the Staffordshire area.
And I'm Monique Pinks, the one of the reps for the Staffordshire Area Health Branch.
Okay. Right, so Unite has done a previous Facebook Live session on the Just Culture Guide, and we did that in conjunction with NHS Improvement. You can see that on the Unite in Health website, and I think the link's been shared on Facebook and Twitter if you use either of those. I'm not sure if you've done a Facebook Live before, but you're very welcome if this is your first one, and if it isn't, then obviously equally you are welcome. You can't see here, but we've got a live audience behind, and we've got Nathan who is supporting us with the IT, so thank you very much, Nathan. And what we thought would be useful, having done one before, was a session that's a bit more of a practical session, so looking at how you can use it in practice, which we hope will be useful for reps, managers, but generally anybody that's involved in patient safety incidents in the workplace. We're framing it around a fictitious but hopefully realistic example, and I have two Unite regional officers who are going to provide answers, so we're just going to swap. So we invite Sue to join us. Sue, do you want to introduce yourself?
Hi, I'm Sue Lowe. I'm a Unite Regional Officer, hopefully here to answer some questions today.
Brilliant. And if you've got a question or a comment, then please just comment on the Facebook page, and then we'll take the questions afterwards. So, first of all, what we're going to set the scene really. So, a member has given the wrong dose of a drug to a patient that's led to the patient suffering serious side effects that's required them to need additional treatment. It was a drug that the member hadn't given before, and it required them to calculate the correct dose according to the patient's weight. The Trust has launched a patient safety investigation. So, Sue, I wonder if you can tell me, how would using the Just Culture Guide help in a situation like this?
So one of the things that we've highlighted before is that the Just Culture Guidance is very much about looking at whether there was an intent, whether this was a deliberate thing, whether there was an intention to cause a deliberate harm. And I think those members that are registrants also always have a feeling about that. They always know that that's around. But obviously for the rest of our members and employees, we are always quite clear on whether or not something was intended or not, whether it was something that was around what was going on at the time. Obviously, if there was an intent, then we've got policies in the workplace that will deal with that. But Just Culture, the focus really needs to be on whether there was an intent, whether this was deliberate. And I think we can all appreciate that as NHS workers, it's very rare that there's an intention to cause harm, and so that's why we welcome this so much.
Yeah, brilliant, lovely. Okay. So, when the member was spoken to by management about the incident, they said that they didn't realise that the calculation that they'd done was incorrect, and they didn't realise they needed to know the patient's weight in order to calculate the dose. So again, using the guide, what impact would that have if you're following it through?
So those of you, if you've seen the chart that comes through, there's a section on this where we look at the health test. It's a nice punchy chart that gives you a pathway to work through. We all like pathways and guidance, don't we, when we're trying to make a decision. So the health test, for those of you that have been reps for a while, will be quite simple. If there is no intent, why did it happen? What was wrong? What was the situation around that? And of course, if we're working with individuals here, was there a health problem? So a lot of us are dealing with a lot of stress in the workplace, People, we've got presenteeism where people are coming in despite the fact that they're unwell. If there are drug and alcohol issues with that individual, is there something here that has gone unseen, unsupported? Is there something that we haven't seen? So the health test is really important. It has to be a positive response to that. How can we prevent this happening in the future? But by looking at the health test, is this something that we need to look at? But again, if the response to the health test is negative, we go back to our usual policies and procedures.
Okay. So going back to the scenario, and I think we'll go to you this time, Frank. So in this scenario, it's confirmed that there are no substance misuse or health issues, and the manager says that following previous concerns about this particular drug, a new protocol was introduced, but the member didn't follow it. The member, however, says that they're not aware of the change in protocol. So again, looking at the foresight test, which is the next one following the guide down, can you explain what this means and how that would help?
Yeah, thanks, Jane. Well, the foresight test looks at whether there are agreed protocols in place in the workplace, and if there are, whether they are workable and routine use, and whether the individual did not adhere to them or not. And as Sue was saying, if they don't adhere to these protocols that are in place, employers will have policies and procedures for dealing with that. But if there is a positive response, you move on to the next question really. If there's a negative response to any of this, it's unlikely that singling out an individual is the appropriate action. It's wider action is needed. It's sometimes a cultural issue or an issue in the workplace where maybe people haven't been taken through the protocols that exist.
Brilliant, thank you. Okay, so again, in this scenario, it's established that there was a protocol in place, but it was relatively new because they'd introduced it following new information on the potential side effects. So again, how would this impact potentially on the member in this situation?
Well, again, I would say the substitution test looks at whether the colleagues from the same peer group will have followed the protocol. And it's, as healthcare professionals, it is about adhering to guidelines and protocols at all times. Whether the member had missed out on training or whatever, whether the member should have been receiving supervision or not in the workplace in what they were doing. If no to all of those, then you move to the next question. And if yes to any, again, there are wider system issues, so singling out an individual would not be an appropriate step, we believe.
Yeah, okay, so having said that, let's move on to the next question. We're getting through this quite quickly, but it's established that the member was off sick at the time that the change in the protocol took place, so they hadn't attended any training, and also the department was short-staffed when they returned to work, so they had no opportunity for an update. So again, how would the guide take you forward in that case, Sue?
So this again comes back to singling out an individual. We don't want to be looking at that individual when wider actions are more appropriate. So if somebody is off sick, where is the cover? Where's the training? Where's the return to work interview where they discuss the training and what's gone on whilst they've been away? Where's the extra supervision to ensure that they know what to do? I think we're quite clear that in some organisations where pressure is very high, you can have been off sick for 4 weeks. It doesn't class as long-term sick leave. So you turn up on the first day and you hit the ground running. You're given your work to do and off you go. And obviously in these circumstances, this actually would be something that we would pull back on. We call it mitigating circumstances. And what we're doing, we're absolutely looking at whether the organisation supported the individual to follow the protocols that Frank's discussed. That if the protocols are in place, if you don't know about them, you haven't used them before, hasn't been discussed with you, so for instance in supervision, then how can you be expected to have followed them? This then takes us on to possibly the whole reason of being for the Just Culture. This is about patient safety. Our members, our staff are not automatons. They don't just turn up and do what they've always done. It's an ever-changing picture, and they need to be fully informed and fully aware to perform their role, to do, to do what they do. So to blame an individual for not following a protocol they weren't fully informed about is, well, I think everybody that's listening is probably thinking, well, that wouldn't be fair. And it's the "it's not fair" line, I suppose, that comes through. So the mitigating circumstances, we'll look at if it's not their fault, then, but again, it comes back to that if they deny that, then you don't have to go through a disciplinary process. It could be that further training, support, performance management, there's a lot to be done before you start to blame the individual.
And I'm sure Sue would agree, and other colleagues, it's one of the things we're seeing as officers more and more often, the pressure that's on frontline staff, the staffing levels, and then the issue around when people are off sick. We know sometimes training does suffer, or releasing staff for training does suffer. One of the first things that would be hit when there's pressure on at the ward and department level. But it is important, and this singles out, as Sue said and Jane would say, it's important that our members realise that they should be taking up those training opportunities that exist. They should be attending their updates on a regular basis, and if they're having difficulty being released for those, then they should be documenting those concerns as well.
So, a question to both of you really. Have you, I mean, this was launched in, I think it was March, April time, and it is, I mean, people can go onto the NHS Improvement website and you can see the tool, and there's some very useful scenarios that go along with it if you're a manager, you want to do training. But have either of you had cause to use it in your practice yet, supporting members, or have you had any feedback from reps that may have used it?
I mean, certainly in some of the incidents and the casework that I've been dealing with, there is a growing acceptance now from employers to want to look at wider issues and what's impacted on. And given where we're hosting this event tonight in Staffordshire and a lot, what has gone on in the past, it is important, as Sue said, we support our members because our members are there to support and look after patients and frontline care. So we don't want to see individuals being singled out for blame for things where there is sometimes a systemic, cultural or organisational failure. And it is certainly starting to become something we are referring back to employers to say, well, what have you done? Why haven't you done this? What would you do? This is what you need to put in place. Sue, if you want to...
Yeah, I think one of the things that, although this is meant to be a preventative guide, this is about a culture where we work to be supportive. As you know, you've got a duty to raise a concern. You've got a duty to raise an issue in the workplace. But if the system doesn't support you to do that, the one thing I know that I've done definitely is when you're in disciplinaries or in appeals, you actually put that question. You say, was just culture adhered to here? Who went down the checklist? And it's a way of looking at the investigatory process right from the very beginning. If you think about it, is if you get into trouble at work, the first thing that happens is somebody says to you, what happened? And it's at this point that this should come into play. It's at this point that any manager that asks that question and then goes on to deal with the answer given by any member of staff should be thinking, right, I need to go through the Just Culture Guide here. We need to take step by step by step. And so at the moment, I'm utilising it as a throwback. But the more I put it into disciplinaries and appeals, hopefully, the more it will filter to managers right at the very beginning to apply it instead, so that I won't be sitting in so many disciplinaries asking that question.
I think that's a really good point that Sue's made. Currently, we're probably using it retrospectively, whereas what we want to be doing is making sure our reps and our members are aware of it. And employers are aware, and we can work with employers to share and learn lessons so that it's not something used retrospectively, it's something that's put in place at the start, rather than, as Sue said, having to rely on it at a later date.
And I think it is about, isn't it, about facilitating that learning of lessons, isn't it? So, because we all know that a blame culture just, creates fear and actually is more likely to lead to people covering up.
Yeah,
so,
and that's the point, Jay, perfectly right. We don't want, we don't want this to be used as people to come forward and raise concerns and put that there, and then other members of staff see they've been mistreated or punished for something when they've raised a genuine concern. And that, we have to get away from that culture that it is okay to, put your hand up and say, I think I've made a mistake, or what did we do wrong, what can we learn? Because if you don't learn from mistakes, then you just keep repeating them.
Yeah.
But I think it needs to drive out the message into the wider workforce that we won't always look to blame people individually. We want to examine what have we done, what's out there to support people to improve performance and make them better
and
professionals.
genuinely learn from it. Yeah. So is your impression that employers are aware of it, or is it still, does it still need to filter out?
I think, I'm certain it needs to filter out. I think the thing that probably does concern me is that we know, we're from, we look after a lot of nurses, and obviously we're in a health branch, so we've got registrants who are using their code. Actually, there's a discussion there around where this is born from, isn't it? Yeah. Around the fact that you, for instance, the incident we've used tonight. So if somebody makes a drug error, it's in the patient's interest that the error is raised, that steps are taken, and that, if, like you say, that person isn't penalised because of that. But the fact that it needs to be rolled out across the workforce is really important, because I don't think people are that aware of it. There's people in the room at the moment shaking their heads. And that is something that, if this is a change to culture that is being led by the NHS and our employers, then actually not only the registrants should know, everybody should know.
Yes,
very clearly.
Absolutely.
And that's something we're really keen to do as Unite the Union in the West Midlands with health sector, to work with employers if they want to. We can do some shared work with them to say this is not about an us and them, this is about improving standards and lifting people up. So we're more than happy to come out and talk to organisations and do some joint training and put on workshops for them. We think that would only enable a belief and a buy-in to the culture that, as Sue said, is needed from all of the workforce, not just some people.
Okay. Thank you. That's really good. So, can I ask our audience if we got any questions following on from that?
Yes, I'd like to ask if a member wants to apply for flexible working, what will their rights be?
Do
Okay.
you want me to say that one?
Yeah.
The law as it stands, the member has the right to apply for a flexible working request and set out what the reasons they would want their flexible working arrangements. As the law stands, the employer then has to look at that reason and see if they can accommodate that reason. And hopefully, in most cases that will be the case, and sometimes there's either a 12-month or 6-month or 18-month review looked at it, because these are flexible working arrangements and things change, so that the employer does have the right to say we can't accommodate that flexible reason. You then have the right to ask for the reasons why they can't accommodate that, and you would need to be given those reasons in writing. So it's not an automatic, you ask for it, therefore you'll get it. You have the automatic right to request flexible working. Unfortunately, the employer has the option to decline that, but needs to give you reasons why they wouldn't be able to accommodate that request. Does that help your...
Yeah, I just wondered if there were any particular aspects that they would have to consider more favourably.
Certainly people with care responsibilities, young children, or even caring responsibilities, people that looked after disabled relatives or children, people with a disability, if it would help them. So the people that are covered by the Equality Act, certainly they need to take those characteristics into consideration.
Okay.
So is there anything in relation to the Just Culture Guide? Anybody got anything to ask?
Yes, I'd like to ask the panel, how can we use Just Culture to support members in the workplace?
Okay,
If I start, and then I'm sure Jane will pick up. One of the things that Unite has been very clear about in health is supporting its members in this very difficult period at the moment. We are very clear that members are working short-staffed, that they are working under pressure, that they're not working in ideal situations, and I think that comes down to premises, health and safety, all sorts of issues. I think we're very aware that people are being pressurised into probably taking on more responsibilities than they should, and so on. So we've been very clear in ensuring that staff know about Just Culture, so that when reps are advising them and saying raise your incidents, put your it's Datex in a lot of organisations in the West Midlands, put your Datex in, put it in writing, quote the Just Culture guide. So as per the Just Culture, this is why I'm raising this. Again, registrants have always had that ability to raise a concern and raise a risk under their code and quote their code. But actually the wider workforce need to feel a little bit more empowered, and reps can support them, and Unite absolutely will support them to raise those concerns. And this is from the NHS Improvement. This is their own suggestions. This is our, as NHS employers, that's their suggestions. So you sort of use what they've suggested to support yourselves. So it's there, it's in writing. Let's empower our members to use that. And Datex obviously is the best way of doing it. But if you need to write a letter or raise with your manager in writing, always put Just Culture in there. Always raise the points that are there.
Yeah, I think you've probably said it all, Sue, but we would like to use this as well as part of the prevention agenda, so that we prevent hopefully incidents, patient safety incidents happening. So we are really working with members to say, if you've got concerns in practice, whatever level you're at, they do need to be raised. We need to be trying to prevent things happening before they do. And as Sue said, we recognise absolutely that people are working in very difficult circumstances, but it's about doing what you can do well, not trying to do everything. And nobody is invincible. We all want to be helpful. That's why we go into the job that we're doing. But you can't do everything. And at some point, if you keep trying to do everything, something, either a mistake will happen, or obviously there's a detriment to yourself as well as a practitioner. So we can't encourage you enough really to raise concerns. And we can do it in a constructive way. We've got letters that can support you to do that, and as Sue said, we can absolutely support you to do it as well, or do it on your behalf if that's required. But what we want to move to is a culture where actually we don't need to do it on your behalf, because organisations are open to people raising concerns and listening to the very people that are at the coalface, as it were, and absolutely know what's happening. So
yeah, I think as industrial officers in Unite and professional officers that look after professional regulation issues, we appreciate the stresses and strains that you, our members at the front line, have gone through in the last number of years with the austerity measures that's been imposed. But as Jane says, we want to move to a culture where people don't feel they have to fear about putting in concerns, that they're able to openly raise a concern with the employer. And as Jane says, this is a piece of work that's been worked up with NHS Improvement, together with the employers and relative trade unions. So, it's not our agenda; it's a shared agenda. We want to work in an organisation. We want to be able to say to our members, "You're free to raise concerns." We want to support our activists and reps in the workplace, that they know that they can raise those concerns on our members' behalf. But it is important to remember, this is about, as Sue said at the outset of this, and Jane said as well, this is about raising patient safety standards. But for us, looking after our members in the workplace, it's making sure that our members feel that they're treated with dignity and respect in the workplace. As Sue said, we know you're working above and beyond your contracted hours, and you're doing more and more because there's less and less of you. But we want to make sure that you feel comfortable and confident and strong in your workplace to be able to raise concerns, because you're there as the advocate for the patients and the communities. You'll be there for us, and we'll be there for each other, won't we? And that's what we want to move to.
So, Nathan, have we got questions on Facebook?
Yeah, one of our Facebook users called Beverly has made a comment basically saying temporary staff members are not always included when these updates are introduced. So I suppose the question would be, does this Just Culture guide cover permanent and agency staff who are working for the NHS?
So yeah, we're absolutely clear that if you're working in an organisation, the training need to be absolutely clear. So they should be included, yes. If you're working, I'm presuming if she's talking about health, she's either bank or agency. There is a responsibility on an organisation to ensure that the staff that they engage are properly trained and properly equipped to do the work that they're being employed to do. So yeah, absolutely, that does apply, absolutely.
Anything to add, Frank?
Yeah, it certainly is. You want to know that the staff you're employing are competent and capable of doing the job that you're employing them to do. So if they're not making sure that these staff have the opportunity to train and develop in the same way, then but as we've said earlier, we know that people are very stretched at the minute, and training is sometimes one of those areas where maybe people who control the money think there could be savings made, and this is this obviously is a false economy in our belief.
So thank you, great question, Beverly, and obviously if you want to come back on that, then do, but basically the answer was absolutely yes, it does apply to anybody and everybody working in NHS settings, and we would like to see this extended to other settings too, any more questions at all? No.
Just one.
Yes.
Where training is provided and staff members have concerns that the training provided is not appropriate, for instance, basic life support training becoming an online e-learning session rather than face-to-face, and you raise your concerns with the Chief of the Trust and he shares your concerns, but there are no changes likely to be made due to the cost saving of changing this training to a non-face-to-face training. Where do we stand?
Well, it's about, right, so one of the things you need to do, so you've raised your concern if you're a member of the staff in that employer. Every member of staff, this is why you need to be in a union. Because if you've gone as far as you can and you've raised your concerns, well, as obviously we will always say you do it in writing so that you can evidence your concerns. But the escalation policy, that's something that we adhere to as practitioners in the workplace as an escalation. Because of this matter is something that you've raised around training, you would go to your union rep. You would ask your union rep to raise it for them at one of the policy forums, the joint negotiating committee, for instance, and raise it as a concern. It is absolutely something that a union member would use their union rep for. You've gone to the top and it doesn't come back down again, then that's what your union's there for. The joint negotiating committee, for people that don't know, is where the union reps and the managers and the chief executive of the trust come together, and this happens across the NHS under different names, where they come together and they discuss what's going on in the trust, raise any concerns and so on. The JNCC, I think, in this area will then report up to the board. So papers have to come through and down. So all of the changes that go on have to go through that committee. So absolutely, this is where, as a trade union member, you would absolutely go to your rep and ask for support with that. There is a big push towards e-learning at the moment in the I would say across employers, as people are so stretched because of this, this austerity agenda that it feels never ending. And this e-learning, for those of you that have done any training in teaching and assessing and ensuring that learners are doing well and achieving, we know that e-learning is absolutely not a model that is recommended for good learning and an assessment tool, and especially something as important as life support. It's, to me, when you need to check whether or not somebody's capable of doing life support, you really need to be sure that they've done it, and ticking a box on the screen would not feel safe at all. So I would absolutely say use your union rep and push that.
And if other people are concerned as well, try and do it as a collective, so it's not just an individual raising concerns. You've got a group of people raising concerns, but it's up to the organisation really to show you the evidence that, this is a safe training package. It's not up to you to prove that it isn't, it's the other way around. They should be able to prove to you that it is. But
I think one of the things it also raises, when we've got, and we see this across the West Midlands, myself and Frank work in health across the West Midlands, We see an awful lot of provider organisations very apologetic for the fact they're having to deliver under a very difficult financial situation, which actually Unite understands. As you know, we've done a lot of work around commissioning, providing the fact that budget's coming down, especially in public health and community trust. We've seen a lot of financial pressures, and we absolutely understand that, you know, you can have chief executives saying it's very difficult, this is why we're doing it. But that is no excuse for not doing things safely. That is no excuse for compromising on patient safety. And we would always argue that we'll take all the excuses under the sun, but we won't sit back and do nothing. We can listen to your excuses, but we're not going to act on them. At the end of the day, this is about us challenging and saying, yeah, we understand you're in difficulty, but patient safety comes first. And training is absolutely essential for our staff. Again, just culture, you could imagine the defence you'd have if somebody was unable to act because of inadequate training in a life support situation. That is not acceptable in our NHS. And it's something that as a Unite officer, I absolutely would argue directly back with the chief executive, and our reps and our officers can do that on anyone's behalf.
Thank you.
Okay. Have we got any more last minute questions? No. So I think that brings this section to an end. So I hope you've enjoyed it. If you haven't taken part in Facebook Live before, I hope you found it useful. I don't know, Monique, do you want to say a few closing words as the branch chair? Just because we're hoping, I think, aren't we, to be able to do some more of these, or some different ways of running the branch?
Yeah, because people are finding it very difficult to get to branch meeting, we thought that this might be an alternative way of reaching out to other people. So I'm hoping in the future that we'll be able to do more of these, and if members have got particular issues that they want us to concentrate, that's fine. Please just message us and let us know. Today is also, we're launching our Facebook page for Staffordshire Area Health Branch as well. So hopefully you'll be able to comment on there too.
Yeah, and just to say to the health sector members and workers in the West Midlands in a workplace branch, if your workplace or your branch wanted to do a similar event to this, we would soon, myself, Jane, more than happy, and Nathan, obviously, our team man, obviously, we're more than welcome to use our new social media channels to communicate with members out there. So if you want to let us know, just get in touch with Unite the Union in the West Midlands.
So all it remains to do now is to say thank you to Frank and Sue, and thank you very much, Monique, as well, and to Nathan and our audience. Thank you very much. We hope to see you again. Thank you.